Hello all, I'm Dr. Neema Bhat, Senior Consultant Hematologist, Bone Marrow Transplant Physician, and I'm also a Pediatric Oncologist. June 19th is celebrated as Sickle Cell Anemia Day. So what is this sickle cell disease? Being a hematologist, it is my duty to educate you a little bit more about this type of anemia or low hemoglobin disorder. So sickle cell anemia is again a genetic disorder which causes patients to have low hemoglobin. It might require them to take regular blood transfusions. It can also cause certain symptoms like swelling of certain joints, large spleen, which is an organ that is present in the body, recurrent infections, sometimes reduction of blood flow to the brain, and sometimes recurrent chest infections. So what are the types of sickle cell disease? It's absolutely important to know when anybody is diagnosed with sickle cell anemia, how severe the variant of sickle cell anemia is. There are two main variants. The one that is diagnosed in African subpopulation or subcontinent is called the African variant. And there is another variant present in the Asian population, mainly the Indian population, that is called the Indian variant of sickle cell anemia. Why is it important to know which kind of variant of sickle cell anemia the patient has? The African variant of sickle cell anemia tends to be a lot more severe phenotypically, which means the patient tends to have a lot more symptoms. Little babies, have lower hemoglobin. They present with swelling in their fingers and joints. They have a lot of what we call this pain crisis or pain episodes. They are at risk for developing a stroke, which is reduction in the blood supply to the brain. They are also at risk for having recurrent chest infections. And it can be very difficult to control the African variant in spite of regular blood transfusions and starting them on this medicine called hydroxyurea. So if the severity is so bad, then some of these patients may need to undergo a highly skilled procedure called bone marrow transplantation. The other variant, which is the Indian variant or the Asian variant, can be slightly less severe, mostly diagnosed if the child has low hemoglobin or is looking very pale by a simple blood test, and may require a few transfusions here and there, may have a few painful episodes, and is mostly able to be controlled with a medicine called hydroxyurea, which is started by a hematologist after the appropriate blood tests are done, and may probably require a few courses of antibiotics if they have some infections. How is the sickle cell anemia diagnosed? As I mentioned, usually it presents with either swelling in the small joints in the fingers or other joints in the body, mostly presents in childhood. The children can also have pallor, or they can look much pale compared to their other counterparts. They can have fatigue. They may also sometimes present with a severe variety or severe symptom like an acute chest disease or pneumonia, at which point if you do blood tests, it's possible to pick it up. And how do you diagnose it? So best thing is to approach a pediatrician or if possible a pediatric hematologist or a hematologist who would run simple blood tests. One of them is called hemoglobin electrophoresis, where this hemoglobin S variant is picked up and the patient is diagnosed. It is also established further by testing the parents with the same hemoglobin electrophoresis test so that the diagnosis can be confirmed. So what are some of the precautions that patients with sickle cell disease should take so that they don't run into all these issues I spoke about? Main thing is to avoid extreme temperature changes. So if you're going to places with extreme heat or warmth, make sure that you keep yourself cool, stay in the shade as much as possible, hydrate yourself very well so that you don't get dehydrated. On the other hand, if you're going to a place that is extremely cold or snowy weather, then make sure you cover yourself with warm gloves and warm socks, and you don't allow your body to be exposed to extreme cold. Also important to watch out for these pain episodes that can cause swelling in the joints, and approach your hematologist so that you can get plenty of hydration and supportive pain medication and probably blood transfusions if required. And be watchful for fevers, infections. Try to avoid very crowded areas and try to avoid getting infections, even something like a respiratory infection, because that can precipitate the painful crisis or pain episodes. If you need any further information about sickle cell anemia, please feel free to contact or look up on my website. I'm Dr. Neema Bhat, consultant hematologist. Thank you.